Hi, this is Robin Blake, nurse practitioner student from Walden State University. Hello, my name
Hi.
is Robin Blake, nurse practitioner student. I'll be conducting your assessment interview today. Could you tell me your name and your date of birth?
Sherry, April 25th, 1978.
Okay, Sherry, and how would you classify your ethnicity?
African American.
Okay, and how old are you?
36.
Okay, what brings you in today?
So I'm experiencing outer ear pain and my hearing is muffled.
Okay, when did you first notice the symptoms?
I would say like 3 days ago after a pool party.
Okay, so tell me a little bit more about your hearing loss and your ear pain.
So I'm noticing that my ear is painful to touch. So if I put on earrings or something, it hurts. Also, in terms of hearing, if someone's talking, I'm hearing like every other word.
Okay, have you had any fever or chills?
No,
Have you noticed any drainage, like any liquid coming out of the ear?
no.
Okay, take your finger and just show me where exactly you have the pain.
Oh, okay. I would say like right here.
Okay, all right. And have you tried taking anything for this pain? What have
Yeah.
you tried taking?
I've been taking ibuprofen 400 milligram like twice a day.
Okay, has it helped at all?
Not really.
Okay, have you tried anything else?
No.
Okay, now on a scale of 0 to 10, what would you rate your pain if 10 is the worst pain you've ever felt?
I would say like 4 to 5.
Okay, all right. That's kind of significant. Is the pain along with the hearing, is it affecting anything you do on a day-to-day basis?
I would say so. I mean, I'm having an issue with hearing, so I'm having to ask people to repeat themselves.
Okay.
Yeah.
Okay. Any history of this in the past?
No.
Okay. Within the past, I guess, a couple of months, have you noticed any changes in your weight or any skin issues, rashes, moles, changes in the rashes or moles?
No.
Okay. Any history of illness or injury?
Yeah, I had chicken pox when I was like 3.
Okay. Do you know if you had any problems afterwards following the chickenpox?
No.
Okay. Any allergies? Excuse
No.
me. Any history of hospitalization?
No.
Any transfusions?
Mm-mm.
What about your immunizations? Are they up to date?
Yes.
Okay. Your tetanus is usually given every 10 years. Have you had that recently?
Yes,
When did you
actually.
have that?
January of 2016.
Okay. And what about your flu and pneumonia vaccinations?
Yes, January 2016.
Okay, good. And have you had any changes in your vision or noticed any problems with your vision?
No.
Okay, do you wear any corrective lenses?
Nope.
Okay, when was your last visual examination?
January of 2016.
Okay. And other than what we talked about with your hearing kind of seeming muffled or like just not where it should be, have you have any other hearing problems?
No.
Okay. What about any bleeding gums or mouth sores?
No.
Have you had a dental visit recently?
Yes.
When was your last visit?
January 2016 as well.
Okay. Have you noticed any problems with sinus infection or repeat sinus infection? Any seasonal allergies?
No.
Okay. Any problems moving your neck?
Mm-mm. Nope.
What about your arms?
No.
Okay. Any shortness of breath?
No.
Any history of asthma or tuberculosis?
No.
Okay. Any chest pain?
No.
Chest tightness? Do you
Mm-mm.
notice any swelling of your hands or feet?
No.
Okay. Any pain in your stomach?
Mm-mm. Nope.
Any nausea, vomiting?
No.
Are you having any difficulty having bowel movements?
No.
When would you say I'm sorry, how often would you say you have bowel movements?
Like twice a day?
Okay. And any difficulty with that?
No.
Okay. Any problems urinating?
No.
Okay, so no pain or urgency or frequency.
Nope.
Okay, how often would you say you urinate?
Like 4 times a day?
Okay. All right, we're going to move on to your reproductive history. What's your sexual orientation?
Heterosexual.
Okay, and when was your first menses?
Like 12 or 13?
Okay. Are you sexually active?
No, I'm actually celibate.
Okay. When was your last menstrual period?
It was around June 20th, and I think it lasted to about June 24th.
Okay, and this was normal for you?
Yes.
Okay. And when was your last pap smear?
January 2016.
Okay. Um, Now, do you have any history of sexually transmitted diseases?
No,
Any pregnancies,
no,
abortions, or miscarriages?
no.
Okay. What about self breast exams? Do you do those?
Yes.
Okay, good. How often?
I would say like once a month.
Okay, great. Um, any changes in your skin?
No,
Okay. And then we're going to move down to your any bony fractures or any significant bone injuries that you've had. Have you had any history of that?
no,
Any swelling of your joints or any pain in your joints?
nope,
Okay, good. Any problems walking? You notice any balance issues or any weakness in your legs? Anything like
no,
that? Okay, good. Any problems with excessive thirst or unintentional weight loss or weight gain?
no,
Problems with your memory or problems thinking?
no,
Any changes in your voice?
mm-mm,
Okay, good. The next thing we're going to talk about is your social history. So, do you smoke at all?
nope,
Ever smoked?
no,
Okay, do you drink any alcohol?
occasionally,
Okay, and what about any illicit drug use?
no.
Okay, good. What do you do for a living, Cherry?
Project management,
Okay, and how long have you done that?
about 10 years.
Okay, and so, how much education did you get for that? Did you go to college?
I have a master's.
Okay, good. Do you exercise regularly?
Yes.
What do you do?
I do like kickboxing, yoga, Pilates, kettlebell,
Okay.
all that.
Good. And any hobbies?
Yes.
Okay. What do you like to do in your
Shop.
spare time?
Shop, travel, read.
Okay. Good. Do you wear your safety belt when you're your seat belt when you're in the car?
Yes, of
Okay.
course.
Okay. So the next set of questions I'm going to ask you about are with regard to your family history, your siblings, your parents, your grandparents.
Mhm.
You can just let me know if any of the things that I list that you're aware of with your family.
Okay.
Any history of cancer or
No.
seizures, any
No.
visual or hearing disorders,
Nope.
any tuberculosis, asthma,
No.
COPD,
Mm-mm.
heart disease,
No.
diabetes, high blood pressure, any
Nope.
thyroid disease,
Nope.
multiple sclerosis,
Nope.
cystic fibrosis,
No.
any blood disorders.
No blood disorders.
What about sickle cell anemia
No.
or arthritis?
Yeah.
Okay, who has arthritis or who had arthritis?
My grandmother did.
Okay, and is this your mom's or your dad's grandmother?
This-
Mother, excuse me.
It's my mom's mom.
Okay, and can you tell me a little more about what type of arthritis she had?
So all I know is that she was injured at work, like a back injury or something like that. So it was related to that.
Mm-hmm.
And she was around 30 when it
Oh.
happened.
Okay, and I have to go back a little bit for 1 second. Just want to know, what did you eat for, what's going to last like 24 hours?
Okay. Let's see. So for breakfast, I had orange juice and oatmeal.
Mm-hmm.
And then I had like a small green salad.
Okay.
I did drink my water. I had like 64 ounces of
Mhm.
water
Good
today. For lunch, I had like a turkey sandwich.
for you. Okay.
Then I had like some cashews. And for dinner, I had like baked fish and some broccoli.
Excellent. You know, you're doing well. Is there anything else you want to mention to me today?
No.
Okay. Well, thank you so much, Sherry.